amount was not enough because, again, like he said, there's a lot of alcohol and drugs and all those things. And probably one is watching us and thinking, how does that affect, especially the number that is required, to fertilize an egg?
Yeah, I think, excuse me, at the starting of the show, we said that the number of people coming in with poor quality or lower sperm or male fertility is on the rise.
Sure.
And it is actually true.
Yeah.
And one of the reasons is the alcohol, is the smoking, is the marijuana, all these drugs. And the reason is they are toxins. And what toxins do is that they affect the process of growth of cells that grow very fast. And one of the cells that grow very fast are the sperm cells. Yeah. So such toxins will affect the production. Okay. They will affect the way the sperms look. And they will affect, of course, the way they move. So they affect all aspects of the sperm quality.
All right.
So if you had 40 million and you heavily smoke, you heavily drink, you use all these other toxins or toxic substances, they will reduce the number maybe from 40, and sometimes you can get 5 million, 300,000. I mean,
Okay. So is it more on the duration of time? Because I've had someone say, but me, my grandpa used to drink, drink themselves silly. My dad used to, but they had like 13, 14, 15 children, right? Yeah. So is it what you take? Is it the duration of time, or is it the amount?
I think it's all.
All of the above.
It's all of the above.
Okay.
Duration, of course, but I also think people are starting to take alcohol a lot earlier than, those people
true.
in,
True.
and also those, earlier people used to eat right foods. They were all, if you're eating food right from the garden that doesn't have any chemicals and pesticides, that doesn't have, and fresh green leafy vegetables, fruits, those are things that help with the antioxidant properties. Basically, they work against these toxins. So I think the diet was different. They also would walk to work, or we have a sedentary lifestyle, so we are more obese, we are unhealthy. So there's a lot of factors that are coming into play in terms of environmental factors for us right now.
Yeah. And can we just address that deeply in terms of the different environmental factors that might lead to the same, and then we'll come back to, like the medical aspect of it that might lead to a case of infertility. Let's focus on environmental and mostly lifestyle, because again, like we said right now, and especially younger people, initially it used to be like an age thing where the older you get, the more, but now we're also seeing in younger men who are having issues as far as, fertility is concerned.
Yes, I just to add on to what Dr. has said, first of all, let me compliment the two patients, David and Francis. These are brave people, because it's very, very, very rare that men come on in public and talk about their fertility issues. So thank you very much, because that improves the quality of our discussion. Now, among the things that will cause men to have infertility issues, as you said, it's a myriad of problems. And we cannot pick on one particular thing and say this one will definitely cause a problem. But you asked specifically about the environment and the diet, I think. Yes, we do know, as Dr. has said, you see, every living person is made up of cells. These are alive, they require blood, they require nutrition, which comes in blood, for their well-being. Okay. Anything that affects that microenvironment will interfere with the production and development. And we talk about lifestyle being composed of healthy living. From the time we're in primary school, we were told about have a balanced diet, have fruits. These things are kind of, people ignore them. Alcohol, of course, excessive drinking of alcohol will interfere, because these are toxins. The liver has to work on them to basically break them down. As the liver gets tired, it also begins affecting other hormones in the body which are being produced. Smoking is a well-known substance that interferes with blood flow. The conditions like diabetes, hypertension, all illnesses, any illness that a person has that has been there for some time, it causes some stress on the body. Any stress of a particular, for whatever reason, stressful situations interfere with hormones in the body, and a man's microenvironment is an interplay between blood flow, hormones, well-being, and the cells. So anything can actually cause a problem. We also have, as Dr. said, about people who have an injury, or maybe some investigation that were done, or some interventions for medical illnesses, and somebody is getting medications. So anything can actually interfere. So there is a complex interplay of so many factors. And one of the, I think it was Francis who mentioned about, oh no, I think it was David, who talked about drug abuse for some time. So these are all factors that have been known to cause a problem. Does it mean that things will be reversed when he stops that? Nobody can say for sure.
Okay.
But any improvement in your health, in your lifestyle during your development years will contribute to good quality sperms. So it is an interplay of so many environmental factors, and also how active you are. A lot of infertility or subfertility in men is associated with obesity. People who sit, you basically add weight. That weight is an environment that converts the testosterone that a man produces into a female hormone called estradiol and estrogens, which a man will need. But in excessive amounts, it now interferes with the quality of the sperms of a man.
That is produced.
So, so there's a whole interplay of environmental factors, diet, lifestyle.
Yeah.
Yes.
All right, and it's important that we're talking about it so that people know. All right, and Dr. Ndegwa, very quickly in terms of the medical factors that might lead to a case of infertility. Of course, we talk about undescended testis as well, but what are some of the other medical factors that might lead to a case of infertility?
So medical factors, I think Dr. Misango has also touched on some of them, but there are things from birth that we can check. So for undescended testis, I like to speak about it because sometimes I find patients never knew, and I think it's just the worst because it can be corrected.
Yeah.
If you have undescended testis and it is corrected by the age of 1, usually we like one, he's a urologist, so he'll tell us 1 to 2, we will get pregnant later in life. But a lot of people, it was never detected, and then at maybe in the adolescence, then I find, oops, I have either one undescended testis or both of them are not there, and then that's when a surgical correction is done. And at that point, unfortunately, with the testis being in the abdomen, it has been overheated because heat is production of sperm in the testis, and there is no reverse. So such a man more likely will have something we call azoospermia, which is no sperm production, and therefore he would be in the infertile range of inability to ever get his own genetic child. So I think that's a very painful one because it can be corrected.
That's true.
There are other ones where it's a genetic factor, and he was never ever born with the function of actually producing sperm in the testis, and unfortunately for that there's nothing that we can do about it. There are conditions like mumps and other illnesses, febrile illnesses that can affect a child in adolescence, especially in the growth period where the sperm is, the testis is really working, and in the adolescent period, if you get mumps or some febrile illness at that point, it can also affect your testicles and then also cause you to have no sperma. So that's an important thing to note. So there are other conditions such as sexually transmitted diseases, and I think this is also important, to talk about because what chlamydia and gonorrhea might do to a woman, block the tubes, can also happen in the man. So they would block the tubes of the man, the vas deferens, which are where the sperm are transported out into the ejaculate stage. So you'd find that you did have the ability to you actually have sperm and it's being produced, but it's not flowing out because the tubes are blocked.